Hey everyone, Dr. Nadia Reads here, naturopathic doctor. Thanks for joining me this Saturday night. Please bear with me as I don't have a proper stand for my mobile because I've been traveling and left it behind. So tonight I am so pumped to bring you Dr. Kate Scott, naturopathic doctor. She's a naturopathic doctor from Kingston, Ontario. She is amazing, and we are bringing her on to talk all things sex drive and health with us tonight. And we are going to be inviting her on camera. Do, do, do. Da, da. Let's see here. So, Dr. Kate, if you are there, I don't know why it's not letting me bring you on. Of course, all the tech things all the time. You can request to be on. Oh, here we go. There we go. So Dr. Kate Scott is a naturopathic doctor in Kingston, Ontario, and she is joining us tonight to talk all things sex drive. And so we're going to be getting three key things from Dr. Kate tonight, or Dr. Scott. I didn't ask you how you prefer to be addressed as. Hi.
Hi. Okay.
Sideways. You are sideways. I need you to
no.
Yeah.
Okay, let me try to figure this out here.
One time, Dr. Bellis and I did an entire video sideways, and I didn't.
Okay,
didn't
well,
even
now
know.
I'm gonna have to
Okay,
I had
so grateful to have you here. Hi.
Thank you so much. Hi.
Thanks for joining us. So tonight, Dr. Scott is going to be talking about three things. So why sex drive can be low, what conventional treatment typically is for a low sex drive, and what she believes is being done wrong with typical treatment, and what you can do at home to try and ameliorate this with yourself. So Dr. Scott, tell us about why a woman's sex drive would be low in general. Tell us what could be going on there.
So there's tons of considerations when we have either low libido in a woman, or if we just have a desire discrepancy within a partnership. So, and those are two really different things, right? Because depending on how high your partner's drive is, there may actually fundamentally be nothing wrong with your drive. And I think that's really important to acknowledge, because we often have women similarly, I'll say, to when we see women coming in for naturopathic care related to fertility, for instance, saying, I just know that this is my fault. And then we have to remind them that in almost 50% of the cases, the males play a part as well, right? So in this whole libido conversation, we also have to think about that. But to cut to the chase, there's many, many reasons. So
before you continue, can I just highlight that just so we're clear? So what you're saying is sometimes women can come in and say, that she's having a low sex drive, but really her sex drive might actually not be compromised. She just might have a relatively low sex drive because her partner's drive is so high.
Exactly. So there's there's what we call a desire discrepancy in that relationship, and that's a completely different thing. And then in terms of reasons why your sex drive may actually be low,
for actual medical reasons.
Yeah, exactly. Are things like whether it's hormones, whether it's not exogenous, but stressors that are affecting you, whether it's mental health issues or fatigue, whether you have an infant that is sleeping in your bed, co-sleeping, or a child in your bed, that can affect us, right? Whether it's hormones, although this one I find is heavily emphasized in terms of what people think. Like, women come into my office saying, I think I have a hormonal imbalance, and I wish it was that simple, but it's generally not. And then
so are you finding that women are coming in with low sex drive saying, I think I have a hormonal imbalance? We do the blood work, you run the labs, and then you're like, actually, from a blood, a serology perspective, your hormones seem to be fine. That's
exactly it.
Okay.
So more often.
So then what?
So then what? So that's where it gets a little tricky, and that's where I like to think that I'm doing things a little bit differently in my practice, because I think that the biggest thing that I have found with my patients is that we need to start discussing not just hormones from a serology standpoint in terms of being low or high, but taking a more careful look at how women cycle versus how men cycle, and then how the media wants us or tells us that our sex should look and how it should go. So,
So can you please just describe that better? You're saying, "Hey, Janya, thanks for joining." You're saying how women cycle versus how men cycle. Can you tell me
yeah.
more about that? Like, what do you mean?
So I'll
Tell
circle
us.
back around, but yeah. So basically, as we know, right, women have a monthly cycle, or what should be a monthly
Mm-hmm.
cycle. So whether it's 28 days, whether it's 42 days, right, like different people cycle
Mm-hmm.
on different schedules. Men's hormones cycle in a 24-hour period. So they're just simpler, quite frankly,
Very
right?
different. Very different.
We are complex creatures, and how this reflects in terms of our sex lives is that, you know, men are kind of like a Starbucks latte. You know what to expect, right? They know what they want, they kind of know how to get there, and it's like, it's fairly simple. Women are a
Right.
lot more complex, our desires are a lot more complex, and depending on what time of the month it is, what day of the week it is, what's happened that day, there's just so many factors. And yet in the media, which has a huge impact on how we engage our partners, I believe, because we are just inundated by it, especially in today's day and age with technology always in our face and the tabloids telling us what our sex should look like, what the bodies of people who enjoy sex should look like. Have all of these different inputs, and then we are left to figure out, how to make that work in our relationships. And
So what do you think conventional treatment is doing wrong? What do you think is typically done that you don't agree with when it comes to treating a true case of having a low sex drive? There's actually something going on.
Right. So conventional treatment typically looks like this. So step one is to discuss the woman's ability to experience pleasure. So can you experience pleasure? And while that's important, it, I think, is overemphasized. And then the treatment for that typically looks a lot like, anybody who's watching this knows we're talking about sex. So it's masturbation, right? So they're asking women to go home and self-pleasure and figure out what they enjoy, what they don't enjoy. And while that's valuable and important, I think it's highly overemphasized because, and it's a very, if you think about it, it's a very male model of what sex is and what sex can be. And yeah, so that's number one. And then number two is looking at external factors, or what I would label as external factors. So things like whether, and even though it might seem counterintuitive because some of these are internal to the person, but they are things like fatigue, right? Your experience of fatigue, looking at your hormones, looking at your, like I said, having a child in the bed, looking at relationship struggles and issues. And while these are all important, I think they're overemphasized in terms of treatment. The reason I know this is because conventional treatment isn't getting, at least my patients, results. And
So what are you doing that's getting your patients results?
So what I'm doing is I'm asking women to be, sorry, I have to hold with my other arm now because I'm asking them to become the leaders in the bedroom. And the reason this is so important circles back to the discussion about cycling and how we cycle over longer periods of time. And also, I should say that we're discussing, I'm talking about heterosexual relationships, right? Because we could have a woman and a woman, they're cycling, both over the course of a month. But if you look at a male and a female partnership, the women have to become the leaders in the bedroom because we are more complicated creatures, and we can't be handing over our sexual experiences to our partners. So there's
From a medical perspective, you're saying from a hormonal perspective, because our hormones are cycling differently than a man. That's just to be clear. That's what's like, physiologically, that's what we're saying. Yeah.
Absolutely. Yeah.
Yeah.
So, but at the same time, you know, we need to, there's no like fix for that, right? Like you're not broken. That's the
Well, it's
other way
not, I
to
was going
say
to
it.
say there's nothing wrong with it.
No,
Yeah.
there's nothing wrong with it. That's the
Yeah.
thing, right? So women are coming in saying, I'm having a hormonal issue, and then you test, right? You test testosterone, you
Run the
test
labs.
HPA. Yep, you run all the labs, and everything is looking fantastic. And then I come back and say, yeah, you're having like a hormonal discrepancy between you and your partner in the
Mm-hmm.
sense that your hormones look fantastic. You are perfect. Your hormones look amazing. They're doing exactly what they're supposed to be doing. Um, but what's happening in the bedroom is that you're superimposing a 24-hour hormonal cycle of your, again, we're talking male partner, on your really, really complicated month-long female cycle. And then you're going to ask him to try to figure out what you want today and then get frustrated because you're not able to experience pleasure in that
Right.
interaction, right? And so when we switch that and we get the woman to be the leader, and she knows what she wants and how she wants it and all of those things, then we're able to tell our male partners what we want and get satisfaction out of that engagement. So yeah, that's basically, I think,
So,
what we do differently.
what's one other thing that you can have a woman do outside of the bedroom that can help with the low sex drive? And we're talking about like we ran the labs, the hormones are fine. There's no actual pathology from a medical standpoint that needs to be dealt with. So
Right.
as a doctor, it's like, okay, check mark. Now what? What else can
Yeah,
they do?
certainly. So now, one of the exercises that I usually get my patients to do is to look at how often they're prioritizing their joy. Because I think we jump to this conversation about what things look like in the bedroom, and then we have to kind of take a step back and look at what things look like in the rest of our lives during the rest of the day. And most women that I treat are mothers. A lot of them are mothers to younger children or children that require a lot of their time. I mean, when do children not, right? But they are, from the time they wake up in the morning, literally, they are, you know, jarred awake by crying or somebody asking for breakfast or whatever it is. And from literally the moment that their feet hit the floor, they are at somebody else's beck and call. First it's their child, then it's their partner, then it's, you know, their boss. Like, it's always somebody else. They're prioritizing somebody else's livelihood and their joy. And so then I ask them to just reflect on that. And then they're frustrated that they can't, you know, jump in their bed and have an intimate moment where they're prioritizing their own joy. So it's a big leap. So we have to work on moving through our day-to-day lives and prioritizing our joy in small ways. So whether it's getting into that yoga class that you have kind of neglected because, you know, dinner needs to be on the table, the kids need to be fed, husband's not a great cook, whatever, right? We always have all these reasons to not prioritize our own joy. Whether it's like, hey, you know, I used to make myself up and wear a ton of makeup that I really enjoyed, and now I like do the 2-minute face and I'm out the door, you know, and I'm like, girl, put on the red lipstick, you know, like, do you, right? So that's one of the exercises, is just to revisit where you can find joy in your daily life, just for you, like for nobody else, which is a tough one for a lot of us that have kind of forgotten about that.
I saw this, you know, those like mom memes on Facebook, and you and I are both moms with young children, and it was like Cinderella turning her fairy godmother, turning her into a princess, and it was like how a mom feels when she showers uninterrupted, and it was just like I was like, yes, yeah, like, and it's like you know you love them so much, but it's like I just it's nice to just take a shower uninterrupted. It does. It feels like a magical experience. Like even something that small of taking 10 minutes for yourself, or I have like there's a 5-minute meditation that I downloaded on my phone. It's like even just those 5 minutes, anything that you can do for yourself, right?
Absolutely. Yeah, it's kind of those baby steps, right, to move you towards joy and pleasure in all aspects of your life.
Well, thank you so much, Dr. Scott. Really appreciate that. Thank you so much
Thank
for
you for
joining
having
us
me.
today. All right.
All right,
And
have a good one.
if anyone wants to reach out to you in the Kingston area, how can they find you? What is your website or your
So
number for your clinic?
So my website is probably your best bet. So it's www.curated with a K, so KURATED.ca. And I hang out on Facebook quite a bit. So I'm just Dr. Kate Scott, naturopathic doctor. And I think you tagged me earlier saying that we were going to do this live. So they can just hop on over to my Facebook page and send me a private message if you guys have any questions or comments.
All right, sounds good. Thank you again, Dr. Scott.
Thanks for having me.
All right, thanks for joining us, everyone. This is Dr. Kate Scott, naturopathic doctor. My name is Dr. Nadia Rizzo, naturopathic doctor. And of course, this is Health Made Simple.